Hello viewers, you know, like human memory is very amazing, human brain is very amazing. The functioning of it is still not revealed completely by the scientists. We have been discussing about the memory, how we encode the information, how we store the information and how we try to retrieve the information whenever it is necessary. But at the same time, we also forget the information. No one can claim that I can never forget anything. So, memory and forgetting are both sides of the same coin. There are various reasons why we forget. As the time passes, we tend to forget the information, or sometimes it could be because of the interference with other informations that we are encountering, and sometimes it is also because of lack of retrieval cues. When there are no clues for us to get the information, we feel that we are not able to remember. But there is a different concept called amnesia. This amnesia is different from forgetting. Amnesia is a condition in which memory is disturbed or lost. Forgetting is different, but amnesia, it could be a psychological disorder, or we can say a memory disorder, under which the amnesia plays a prominent role. And amnesia, in one sentence we can say, it is a form of memory loss. It is just a memory disorder. The psychologists defined amnesia as a disturbance in the memory of information stored in long term memory, in contrast to short term memory, manifested by total or partial inability to recall past experiences. This amnesia is mostly because of unable to remember already whatever has happened. That is, our long term information, long term memory is impaired. Whenever it is impaired, this long term memory, there is a possibility of occurring this amnesia. They also defined as a condition in which someone cannot recall stored memories, like what is the maiden name of the mother, or what happened last New Year, but they may recall the joke which you have or which they have heard just a few seconds ago from the brother or a sister. So, it is mainly the impairment of the long term memory rather than the short term memory. Then, why this amnesia occurs? The causes of amnesia are two causes, organic and functional. What are these organic causes? These organic causes are related to the brain damage through physical injury. When the physical injury occurs to the brain, what happens is a defect will be formed in the temporal lobe or a parietal lobe or frontal lobe, which plays an important role for the functioning of the memory. Naturally, when these parts of the brain are impaired, you tend to get this kind of a amnesia. The second organic cause is neurological disease or degenerative disorders like Alzheimer's or various forms of dementia. You know that the cells degenerate as we grow. So, sometimes in the old age, people experience these kind of Alzheimer's disease or different forms of dementia, the memory disability which occur due to the old age. So, these are the other causes for the organic for the amnesia. The third reason is using certain drugs which are sedative drugs, not the these are mostly like tranquilizers and other things. Sometimes the medicinal drugs also create the side effects. Because of these causes tend to get the amnesia. Apart from these major organic causes, infections to the brain such as encephalitis, then sometimes thiamine deficiencies, brain tumors and strokes also lead to the occurrence of amnesia. So, these are various organic causes. Whenever the brain was injured or damaged, or whenever it is getting affected with the different kind of diseases and infections, there is a possibility of the occurrence of amnesia. Then what are the functional causes? Functional causes are psychological factors like mental disorders or post traumatic stress. We call it as PTSD, post traumatic stress disorders. When a person is under severe stress, even after coming out of the stress, still the person, whenever he thinks of the experiences, he gets affected, and then there may be a possibility of the occurrence of amnesia. So, we can say psychiatric illness is one reason for the occurrence of amnesia. Then the second reason is using defense mechanisms. All of us use the defense mechanisms, but excessive use of certain defense mechanisms like repression, that may also cause amnesia. But apart from these organic and functional causes, sometimes amnesia may also appear as spontaneous episodes, as in the case of transient global amnesia. There may not be any functional or the organic cause, but it may appear suddenly and spontaneously. And sometimes the memory loss associated with amnesia includes everything from a person's past, and sometimes it can only be the bits and pieces. Sometimes complete loss of memory, but sometimes I vaguely remember certain parts, but the gapping I cannot fill it. Like I may know the place, but I may not remember who has been staying there, or I may be knowing where I am working, but not the people around. So, it could be a partial loss of the information. But in most cases, amnesia is a temporary condition and is very brief, lasting from a few seconds to a few hours. However, the duration can be longer depending on the severity of the disease or trauma, possibly lasting for few weeks or even months. Depending upon the occurrence, depending upon the cause, depending upon the severity, we have been classifying into different types of amnesia. The first one is anterograde amnesia. This form of amnesia occurs, anterograde amnesia occurs after the brain trauma and is characterized by inability to remember new information. Suppose if a person is met by an accident, and if that accident has caused any damage to the brain, after the accident, whatever happened, he cannot remember. Who took him to the hospital, how he came, okay, or who has been meeting him, all this information will not be remembered by him until he comes out of it. That is anterograde amnesia. After the incident, after the accident, after the injury, whatever has happened, there is no information from the person. Recent experiences and short term memory will disappear, but victims can recall events prior to the trauma with clarity. Okay, till the accident, whatever has happened, he can remember the information, he can give the details, but after the accident, no information will be registered in his brain until he comes out of this kind of a amnesia. That is called anterograde amnesia. Quite opposite to this anterograde amnesia is retrograde amnesia. So, here it is something where the victim can recall events that occurred after a trauma, but cannot remember previously familiar information or the events preceding the trauma. In the earlier one, after the accident, he will not remember anything, but here there is no long term memory. Okay. That is, before the accident, whatever has happened, he does not remember anything, but after the accident, he remembers perfectly. So, this is another type of amnesia. The third category is transient global amnesia. It is a temporary loss of all memory, but it particularly affects the ability to form new memories with milder loss of past memories going back a few hours. It is very rare and most common among older persons with vascular disease. So, this transient global amnesia also occurs very suddenly, mostly among the oldest people, and here they have a confusion with the people, they cannot identify the people, they cannot identify the time and the space, confusion, total confusion with the people, time and space. that is called, it is global, complete. It is not related to one particular incident or the event. The next one is traumatic amnesia. This traumatic amnesia is caused by brain damage, especially from a hard blow to the head, such as in a car accident. It can lead to anything from a brief loss of consciousness to coma. So, sometimes they may go to the coma, and even people who are into the coma, after they come back, they may not remember completely the whole of the information related to their experiences. Generally, if you can observe, people who went to the coma and came back, there may be a temporary memory loss or a memory impairment, at least related to the few things. And in certain cases, the doctors also say he may come back from the coma, but we can't give any assurance, we cannot give any assurance as to whether he can remember the people, recognize the people. So, that is, it depends upon the intensity of the damage done to the brain. So, this traumatic amnesia is often transient. The duration of the amnesia is related to the degree of injury and may give an indication of the prognosis for recovery of other functions. The next one is Wernicke-Korsakoff psychosis. This occurs mostly among the severe alcoholics. Suppose if a person is addicted to the alcohol, in the ultimate cases, that is when they are leading to the last stage of the alcoholic condition, those people, in those people you find this kind of a syndrome or this kind of a memory disorder, that is complete memory loss caused by the alcohol abuse. This tends to be a progressive disorder and also accompanied by neurological problems such as uncoordinated movements and loss of feeling in the fingers and toes. They cannot move, they do not know how to coordinate, how to balance. Then hysterical or fugue amnesia. We also call this as dissociative amnesia. That is completely like they forget about themselves. There is a personal identity crisis. They cannot remember their name, what they are doing, any information related to them. So, this is called dissociative because completely they see a different personality from themselves. Okay. So, this hysterical or fugue amnesia is usually triggered by some traumatic event which the person feels unable to handle, and usually the memory slowly or suddenly returns a few days later, although memory of the trauma itself may remain incomplete. The trauma will be remaining, but after as the intensity of the trauma is decreasing, slowly they may recover, but the effect of the trauma will be there forever. So, this is called dissociative amnesia. So, these people, they forget about the details, they will end up in some other place, start new living, new life, and then once they get the memory back, they forget about the present situations, go back to the previous family life. Okay. Infantile or childhood amnesia. In most of the people who come for the counseling for the psychological problems, most of the adults, they suffer from certain disorders, certain psychological problems for which obviously the evident reasons are not known. Okay. But once you interact with them, there are various certain experiences which have been affecting them unconsciously. So, that is known as infantile or childhood amnesia. This refers to a person's inability to recall events from early childhood. What sort of events? Very negative, traumatic experiences, which as a child, whatever they have encountered, they do not remember consciously, but they are affecting their present life at the mental level. Okay. And that is because of that kind of the problem, they lead to the other psychological problems. Outwardly at the outset, they do not see any reason for the present psychological problem, but in the course of the interaction with the client, when you try to identify certain events which they do not remember, but still affecting, then we have to give them the counseling for those aspects which they are unable to remember. So, this type of amnesia could be linked to language development or the fact that some areas of the brain linked to memory were not fully mature. Sometimes this infantile amnesia includes child abuse, sexual abuse, all these things which they do not remember, but which they are affecting. Sometimes it could be because of the unable to express the communication, unable to express the language properly, improper language development that may affect their memory also. I think you are familiar with hypnosis. Generally people are amazed with this kind of hypnotic experience, but everyone cannot be hypnotized. Okay? If you have a strong will, you cannot get hypnotized. So, even if a person has a will to be hypnotized, but after the occurrence, after the hypnotic situation, once they come back and if you ask them what happened exactly in the hypnotic session, they cannot come out with the details. They do not remember anything. I do not remember, I only remember I was sitting in the chair relaxing, following the instructions of the hypnotist. But what happened exactly, how I behaved, what I narrated, I do not remember anything. That is known as post hypnotic amnesia. So, post hypnotic amnesia is where events during hypnosis are forgotten or where past memories are unable to be recalled. Probably you can try with people who have been hypnotized, you can just ask them exactly what has happened there, what did you narrate. Definitely they say like I do not remember anything, I just followed the instructions. The next one is lacunar amnesia. Lacunar amnesia is loss of memory about one specific event. One particular situation might have affected you very badly. You may remember all your life experiences under the normal conditions, but one particular event which is creating a hurt, a terrible hurt to you, you may not remember that particular information. That is lacunar amnesia. So, under people, many people who come with the psychological problems, we need to first focus on certain aspects of these. Then it is easy for us to handle the person to come out of the situation. Okay. Consciously they do not remember, but unconsciously those things are affecting them. Next is source amnesia. Sometimes we also feel that we have this, okay, where you give the information, probably it could be on a particular subject or it could be information related to any particular situation. You give the information when your friend is asking you, but you say I do not remember exactly from where did I get this. Okay? That is called source amnesia. It is a memory disorder in which someone can recall certain information, but they do not know where or how they obtained the information. Generally, like we try to remember, I heard from someone or I read from some book, but under these situations you never get any clue as to from where did you get this kind of the information. Then situation specific amnesia is another type. Situation specific amnesia can arise in a variety of circumstances. For example, committing an offense like child sexual abuse resulting in post traumatic stress disorder. It involves narrowing of consciousness with attention focused on central perceptual details, and the emotional or traumatic events are processed differently from ordinary memories. So, here the person who is affected and the person who involved in this kind of an abuse, anyone may suffer this kind of an amnesia. For example, a person who involved in the kind of a sexual abuse or child abuse, once he starts feeling guiltiness, that guiltiness may make him forget about that particular situation in order to make him feel that I am a perfect person, I have not been guilty of doing any offense. At the same time, the victim may also have this kind of a situation specific amnesia. Then prosopamnesia. Prosopamnesia is inability to remember faces even in the presence of intact facial recognition capabilities. How many of you feel that you cannot remember the faces? Sometimes it is possible, we meet the person, but we do not recognize their faces, okay. But at least you are aware somewhere I have met him, or by the kind of the information that they give, you will get the clue. But people who suffer this kind of an amnesia, they have the recognition to various details, but they cannot remember the faces. That is this kind of a prosopamnesia. Next, drug induced amnesia. Sometimes using the drugs will also create a temporary loss of memory. Generally, like the medicines which are used in order to create the surgery or in the process of medical procedures, or sometimes when they are not performed, when the surgeries are performed without giving any anesthesia. So, those things may lead to the forgetting of the information. So, some medicines will create or will have a side effect of creating this drug induced amnesia. Then memory distrust syndrome. This is a new recent phenomena in the amnesia categories. A person by name, that is a psychologist by name Gisli Gudinson, he coined the term memory distrust syndrome to describe a situation where someone is unable to trust their own memory. They are perfect, they are able to remember, but still they feel I may forget. It is something like having a low self esteem about your own memory, you are not able to trust. So, you write everything, each and every point you try to encode somewhere, feed somewhere. So, generally we do not do that, but people who are very suspicious about their own memory, they have this kind of a memory distrust syndrome. They cannot have the confidence about their own memory. Next is blackout phenomena. This blackout phenomena is also once again because of the severe alcoholic consumption. Okay. So, immediately after the intake of alcohol, due to the hangover, they feel they cannot remember anything, or we can say state dependent forgetting. A person who is speaking or who is listening to a person under the alcoholic state, once he comes out of that particular state, he do not remember what he spoke, what he heard from the others. So, most of the people you observe them who cannot dare to talk in front of some people, they can talk all the nonsense in front of them under this kind of an alcoholic state, and they do not remember also once they come out of it. That is known as blackout phenomena. So, these are different types of amnesia, and this amnesia has become a favorite topic not only for the psychologists, not only for the lay people, but also for the film industry. Number of movies have been centered around these kind of amnesia categories, but we have to identify. Once we identify the reason why this person is behaving, what could be the reason for this memory loss, accordingly we can give them the treatment to the amnesia. If there is a brain injury, we need to see some kind of a surgeries, but after that it is possible only to get back some of the memories, but not the complete memories.
Hello ma'am, can we cure amnesia with the help of yoga or meditation?
Amnesia cannot be completely cured only with yoga and meditation. Definitely medication has to be given to the patient, but here traumatic related amnesias, most of the amnesias which occur due to the functional aspects, due to the psychological aspects. So, under those conditions, if you can inculcate this kind of a habit in the patient, doing yoga, doing meditation, the state of mind can be made more calm and stable. So, naturally when the mind is calm and stable, it is possible to retrieve the information easily. So, this can be a part of it. Yoga and meditation can be a part of the medication program, wherein you also have to give the medication.
During night outs, most of the students will get panic about their whatever they read. They will think that by the time we will reach the examination center, there is a chance of forgetting whatever we have read. Will that be considered as amnesia, or it's a general memory loss which the student is experiencing?
So, the situation wherein the students doing night out and then forgetting the information which they read the next immediate day, definitely that is not the amnesia. Okay, we call that as a state dependent forgetting. The student is under the state of anxiety, stress, whether will I be able to remember the whole of the information which I read, will I be able to perform well, whether the questions will be what I read. Okay. So, this kind of an anxiety may inhibit the person to retrieve the information. So, that is just a state dependent forgetting, it is not amnesia.
So it doesn't long last for a particular period.
See, most of the situations in whatever you have asked, once they come out of the examination hall, after some time they remember all the answers. Okay? So, that is not the amnesia, that is state dependent forgetting.
Okay. Can I expect that amnesia is a time specific?
Yeah,
When
definitely.
compared to the memory loss,
Yes,
normal memory
it could
loss.
be for few seconds amnesia, it could be for few hours, it could be for few months. In extreme cases, based upon the intensity of the injury or the psychiatric illness, it could be for few years also. So, now we have discussed how amnesia is different from forgetting, what are the different types of amnesia, and in each amnesia, depending upon the intensity, depending on the cause why it has occurred, it varies from one to the other. So, keeping in view the different types of amnesia, probably we can cure the patient, or we can understand if a person says like I have been suffering with this kind of a memory disorder, under what condition, under what situation this individual might have been encountering this particular problem.